He's from UCSF, and he's going to talk about the role of trigeminal nerve in drug delivery.
Here's a variety of indications for which nose-to-brain drug delivery has been tried. We've already seen that there's a great focus on the cribriform plate and the olfactory epithelium. And this is a cartoon, if you will, of the olfactory epithelium. Down here is the superior portion of the nasal cavity, and here are the olfactory bulbs. And you see that there's four basic mechanisms whereby xenobiotic can enter the CNS, and a couple of them involve nonspecific diffusion either between or through sestenticular cells, supporting cells. There's axonal transport through the olfactory sensory neurons. And there is perineuronal diffusion around the outside of the olfactory sensory neurons. Using a proper tracer for that, you can see actually concentration of a xenobiotic. This is a little bit exaggerated in terms of size, but here's your olfactory bulb, and this projects to paleocortex and basal ganglia. So that in terms of direct specific neuronal connections, that's a more mid to forebrain. Trigeminal nerve pathway, on the other hand, the trigeminal nerve innervates the entirety of the nasal cavity, including nasal mucosa, and the sinus mucosa is through the ostia. So this is a contiguous distribution of epithelium. So they act in many ways similarly. When we talk about the trigeminal nerve in medical school, we learn the distributions of the nerve in terms of the exterior of the face and portions of the scalp. Much more complex are the internal connections with the three, when I say trigeminal, three branches: ophthalmic, maxillary, and mandibular. But you also see that there are some branches that come off and connect with the dura. But this particular structure, if we look at it from a different perspective, is quite separate anatomically from the brain. And as Dr. Thorne pointed out, to go from the trigeminal nerve to the brain involves transportation from the trigeminal ganglion through a sensory route. And that sensory route in turn actually connects with a total of 4 different nuclei in the midbrain to upper spinal column. So the direction of transport is going to be somewhat different. And I just wanted to point out an experiment that I pulled out of the literature here, which says a lot of the same things that Dr. Thorne said. So here we've got a rodent with trigeminal nerve heading back. If we look at it more closely, we see it's a bundle with a bundle of bundles, if you will. And we finally get down to the level of the axon. In this particular experiment, fluorescein tagged insulin, and the way that they distinguished what was happening was they did cell-specific tagging onto trigeminal nerve cells And they also had the fluorescein that they could light up by stimulating it with the proper wavelength of light. And when they superimpose these images, you see that the actual transport in this particular case is in the perineurium. So I think this probably is a counterpart to the perivascular transport that Dr. Thorne was talking about. So when we go back to the original diagram of what was going on in the area of the olfactory epithelium, we see that only one of the three methods of transport is active with trigeminal, at least based upon that one experiment. So the one thing that is certainly significant is that both the olfactory and trigeminal nerve pathways bypass the blood-brain barrier. There's also some product that may bypass both of these, and that would lead to either inhalation or ingestion, and that would actually go in greatest part through the blood-brain barrier if it's to reach the CNS. So with the inhaled and swallowed fractions, neither bypasses the blood-brain barrier. So with the issues of facing nose-to-brain drug delivery, access to the olfactory epithelium can be problematic, and we know that just because of the variety of upper respiratory tract inflammatory diseases that we deal with, in which there is an impaired sense of smell. Transportation across the olfactory epithelium may be problematic, particularly if there's been previous trauma, and drugs may be handled differently by the olfactory versus trigeminal nerve. So one of the things I've noticed just looking informally at the literature is that there are a number of studies that are looking at carriers or additives that are being used to facilitate the delivery of drugs to the CNS via the olfactory nerve and the trigeminal nerve. And here are just some examples. So in a nutshell, I think I'm just basically restating some information that's already been provided by previous lecturers.